Thank you. Thanks, everyone. Thank you all for coming tonight. Thanks for braving this cold November night to come here and be with us on this, our 40th anniversary. As you know, it has been 4 decades of work with St. Boniface Haiti Foundation and Health Equity International. I'm extremely excited that tonight we have Nanette Caniff and Father Jerry Osterman, our founders with us, our co-founders with us. Many of you have been part of this organization for a number of years, and we're all really still building off of the work and the foundation that Nanette and Father Jerry started years ago. I don't think Father Jerry and Nanette, when they first started out in the work in rural Haiti and went from St. Boniface Parish in Germantown down to rural Haiti, that when they started with vaccine clinics, we would now today be the largest hospital in southern Haiti and having over 150,000 patient visits last year. All of this work is really due to all of the support of everyone here. Whether you know it or not, whether it's your first time or it's multiple times, this is really a partnership between everyone here tonight, our team in Haiti, and all of those who work for Health Equity International. We have over 500 staff members working in Haiti right now, doing remarkable work around the clock. One of the people who can't be with us here tonight is Dr. Miliane Clermont, who is our Director General. Unfortunately, she wanted to be here, but she wasn't able to come up. She's working right now at the hospital. But Dr. Clermont has been with us for 30 years. She started in 1994 as a nurse, then went back to med school, came back to Fondé-Blanc. Dr. Cadet and Dr. Clermont worked together in those early days of the one-room clinic, and now is our Director General. And really, we're here representing those incredible over 500 staff members under Dr. Clermont's leadership that really have shown incredible courage and heroism during a very difficult time in Haiti. As many of you know, Haiti is confronting an unprecedented security situation in terms of gang violence being prevalent throughout the capital. The government has had a difficult time functioning, but our work at the hospital has become more important than ever. We are able to continue to provide care despite all these different challenges because of that amazing staff that we are representing here tonight. I'd like to show you, of course, lots of different things tonight, but one thing we're going to do in a little while is to show you a tour of the hospital so you get a better sense of the work we do. But what we want you to know is, despite all these unprecedented security challenges, all these difficulties, there is incredible amount of work going on at the hospital, and it's really a source of hope for so many. The hospital continues to grow despite all of those challenges, and it's really thanks to all of your support tonight. So we're going to start with a quick video for you that gives you a background on some of our work and what's happened over the last 40 years, and then we'll go right into the hospital tour. Thank you.
What does it mean to prove what is possible? It means never giving up on what we know is right, holding tightly to a brighter vision of the future through times of calm and crisis, and trusting in the strength of your friends, partners, community. Since 1983, Health Equity International, St. Boniface Hospital, has been proving that world-class, affordable, and compassionate healthcare is possible in Haiti. From childbirth to surgery, our services are revolutionary in Haiti, where most people struggle to access basic care. At St. Boniface Hospital, quality care is a certainty. Our doors never close, and no patient is ever turned away. We lead during natural disasters and global health crisis, create innovative and sustainable programs that are built to last, and hone Haitian excellence through robust training. Now, in partnership with people like you, we are making quality care available to more patients in more places. We are Health Equity International, St. Boniface Hospital. Join us today as we prove that health equity is possible in Haiti.
So as I said before, we're going to try something different tonight. We're really fortunate in that over the past few weeks, one of our staff members, the head of communications in Fond-des-Blancs native, Gilles, has been going around with an iPhone and taking footage of the hospital. Usually we would like to be able to take people on a physical tour. That tour is usually about 4 hours long as we go through and are able to interact and see all the different services within the hospital. Tonight we'll try and condense it into about 8 minutes. So it's going to be quick. But as we go between the buildings, you'll see the pace gets sped up a little bit. So don't be concerned. We're just going to kind of sprint between buildings as we go through. But we're going to give you a tour of what's going on right now at the hospital so that we can bring Haiti to you and you can see what's happening, and so that we can show you that we really are proving what's possible in Haiti.
Before sunrise, patients leave their home to start their journey towards healthcare in Fond-des-Blancs. They ride on the back of motorcycles, donkeys, to get to the hospital. They come to our hospital in Fond-des-Blancs because they know it has a reputation of providing 24/7 high-quality care at no charge. Patients line up at the entrance looking for compassionate care provided with dignity and excellence. They gather in the waiting area, and over the time, we have had, on average, 500 patients a day, and 50% of our patients come outside of our immediate catchment area. We are the largest healthcare provider in the southern region. From the waiting area, they go see the doctors or to the emergency room if it's needed.
So we went up the path and we're going into the emergency room now. This is our newest building. It was actually built by some people here, Build Health International. And we're going to follow Miss Geneviève as she goes back into the ER here. The ER is one of the busiest places in the hospital. There's all the beds are always full. It's open 24/7. We have over 9,000 patient visits a year in this facility, and it really provides some of the most critical care in the hospital. Day or night, 365 days a year, our ER is functioning like an ER here in the US. What's really exciting as well about our emergency room is that we have the first Haitian-trained emergency medical residents who are now rotating through here. And we're getting trained residents from all over the country through all of our services. We're now going to leave the ER and head over to the lab.
Our lab has grown in accordance with the hospital in size and in the quality of services we are providing. So we test for the routine conditions, but we also test for the emerging diseases like COVID-19. So because of the sophistication we have in our lab right now, we are also training technicians to really acquire the skills they need to work in the labs in Haiti. We are also in partnership with the National Lab of the Ministry of Health to track health trends in the southern region. We try to deliver the test results the same day in order for our patients to start their treatment early and to return home. Now, let's go to the NICU.
So this is our neonatal intensive care unit. It has 50 beds. A 50-bed NICU is actually bigger than the NICU in Boston Children's. So this is a massive NICU on par with major teaching hospitals in the United States. We have over 1,000 neonates go through our NICU every year. And as you can see, we're providing quality care throughout. One of the things that's amazing about our NICU is we're getting patients from all over, 6-hour drive, 7-hour drive away, and even landing patients in a helicopter down the street from the hospital in a mango field where patients are coming from throughout the country to get care. This is Miss Pascal. Miss Pascal runs our NICU. Miss Pascal always talks about the importance of quality care, but also care with compassion. She always talks about making sure that she's singing to the babies as she provides care, because it really shows compassion and makes sure that the babies feel that they're loved while they're in our NICU. You can see also there's all sophisticated equipment here. It's run by Haitian biomed technicians who've been trained on making sure the equipment continues to run. We're now going to head over to our surgical center.
We are willing a patient for surgery. Our surgical pavilion has a 3 operating room suite, and it has become a great addition for the community because we are enclave and isolated. We all hope to live our life without needing any surgical care, but when we need it, we gotta have it. So our surgical program at St. Boniface Hospital is unique in the sense that it provides high-quality surgical care at no charge. And surgical care is scarce in Haiti. When you have it, it's very expensive. We are also a training center for surgery residents from Port-au-Prince, nursing students, medical students. 30 years ago, I had to refer a patient for strangulated hernia on a 6-hour drive to Port-au-Prince. Today, we don't need to do that. We have highly trained, skilled Haitian surgeons to provide that quality surgical care.
We're now heading over to the Spinal Cord Injury Center. We're following one of our patients, Casimir. On the left, were all of our inpatient beds, so we have 16 beds, but we're gonna head over to the right and go into our gym in the center of campus. This was started after the earthquake in 2010, where our board and our team on the ground in Haiti decided we really needed to create a national center for spinal cord injury because there wasn't one before, and there were so many injured patients who needed this care. So we started from scratch this center in rural Haiti, started landing patients with in helicopters, and now have treated hundreds of patients. In our Spinal Cord Injury Center, we don't just do the clinical care and the rehab, we also have psychosocial support, job training, really making sure that people feel independent when they go back home into their communities. And we're not only doing spinal cord injury care, we're also able to do physical rehab for other patients as well. We're gonna head back out through the waiting room and then out into town and onto our warehouse.
Here we are at our warehouse, the big one. We have learned over the past earthquakes that it is necessary, very important, to have supplies in quantities to provide the timely response during times of emergency. So we are trying to get a 6-month supply throughout the year. And as we try to strengthen our supply chain system towards self-reliance, we are often asked to help other health facilities in the region and help them with drugs and medical supplies in times of disasters. So for us, it is very important because if we are not able to treat our patients with the drugs that they need, they have to turn to the local market and buy those medicines at prohibitive costs, which they cannot afford with their meager income. So we are trying to keep our warehouse full all year long to really meet our mission. So night is falling down in Fond-des-Blancs now, as you can see, but we'll fast forward several hours for you to have an idea how incredibly busy the hospital is all night long.
Yeah, and as you can see, we're outside the maternity center, and you can imagine just how many deliveries are happening in the middle of the night. And the hospital is open 24/7 to anybody who comes through our doors. We also have 24/7 care throughout the hospital and lots of family members constantly coming through. We're really proud to show you our hospital. What started as a vaccine campaign and then a one-room clinic now has become this hospital, and we've been able to expand into regional work throughout the Southern Peninsula as well. We have an incredible local staff that's providing all this care, and we're really proud to get behind them in the work that we do. Thank you all for being part of this with us. We really appreciate all your support. You're all part of the HEI St. Boniface team. Thank you.
Thank you.
It's my great pleasure to now introduce Father John Uni, whose place we are now in and who's been so generous about providing this space to us. Thank you, Father John, who's going to do Fund a Need. Thank you, Father John.
Thank you, Connor. Whoa. Thank you, Connor. Thank you, Dr. Cadet. What a tour that was. And we didn't have to get on a plane. That was fantastic, huh? You know, I was just kind of thinking back to the last time I was in Haiti at the hospital and even putting up some of those cinder blocks and bricks and with Jack Manderson and Brian Scott and Hugh McLaughlin when that trip we took down. And now here it is, this fully functioning organization, which is so good. And to think that it's functioning in the way that it does in a country that's not functioning. Not the United States, I'm not saying that. I'm saying, I'm just trying to be a wise guy. You know, with the gangs and with everything happening and just to see what's happening and who's being taken care of and the fact that you're all here this evening to help and support goes beyond any ability for us to say thank you enough. So my role is to take up the collection. How's that? Is that the right thing? We call it the fund a need, and it's really what keeps us going, and it keeps a lot of people alive. And it's because of your generosity and because of the spirit and professionalism of this Health Equity International in St. Boniface. For anyone, anywhere, and anytime, we never give up. Thank you. Speaking of extraordinary, I would like to now invite our board chair, Dr. Michelle David, to come forward and say a few beautiful words. Dr. David?
Good evening, and thank you so much, everyone, for attending this event. You can't imagine how warm my heart is because all of you came to support us doing this work. You have to imagine 40 years that St. Boniface have been present and giving to the people of southern Haiti. When others said it couldn't be done, we grew from a one-room clinic into a 200-bed hospital with world-class facilities and 24/7 care, serving the more than 2.5 million people who live in the southern Haiti. And what you may not know, now we serve more than those 2.5 million because of the continued prolonged security crisis in Haiti. People are actually coming from Port-au-Prince to Fond-des-Blancs. They are coming to rural Haiti because it's not safe in the cities. So we're actually seeing more patients than are used to. So we are showing what is possible under crisis situation and saving lives. We provide reliable, steadfast, equitable care for all with quality, compassion, and dignity. No one has ever been turned away from the hospital. We are always there for our patients. We provide more than 150,000 patient visits annually, more than 400 surgeries per month, more than 4,000 deliveries of babies in Haiti, more than 750 visits per month, ER visit. We are there for the people who need us. We are a leader in southern Haiti, a refuge during this prolonged crisis in Haiti. We are always there for our patients, and the staff is always, you have to realize, the staff live in this insecurity. Their families sometimes are at risk, and they still show up to care for our patients. They've been living with this for 6 years. 6 years of insecurity, and they show up every day to save lives. Can you imagine that? We keep saying to people, how much can you take? What about PTSD, trauma? They lose their own family members to their insecurity, and they still show up to care. So we need to support them. It is an effective way to spend your dollars. So in summary, I just wanted to say, I want to thank you from my heart, my being born in Haiti, to see you, and I'm so grateful for you for your support. And I will show you how the staff and the patient in this video is going to show their gratitude for your support.
Pour le pays d'Haïti, je l'hôpital Saint-Boniface a une grande importance. Pour qui ça? Parce que c'est le seul hôpital qui, dans les moments difficiles, qui toujours fonctionné.
Et surtout, employer l'hôpital, donc c'est des personnes qui formées, des personnes compétentes. Donc ça permet que nous-mêmes nous apprécions l'hôpital un peu. C'est un hôpital qui a meilleurs soins dans le pays.
Bon, l'hôpital là a pile importance pour moi. Parce que je fais premier petit, c'est là que je prends soin. Jusqu'à ce que je m'accouche à nos jours, je prends soin. Deuxième petit, c'est là que je suis, là je prends soin de tout le bagage. Troisième petit, c'est là que je marche, là je prends tout soin, tout le bagage net.
C'est Boniface, toute qualité pour apprendre en pile et surtout comme c'est à bail pour apprendre en pile et surtout il y a plus de capacité comme c'est pour bail des soins avec compassion. Donc il faut vraiment aider dans ce sens.
L'hôpital a vraiment pile service parce que le qui était tombé pour être cassé, l'hôpital là venu, moi envie pour être là normal, Jean bon Dieu fait là.
L'hôpital là a une grande importance pour le pays parce que l'hôpital est un pile monde qui sorti partout. La Gonave, tout ça, il y a besoin de passer plusieurs côtés pour pas jeune soin et immédiatement venir dans le service dans l'hôpital là et jeune pour service.
L'importance de l'hôpital là pour nous-mêmes en tant que stagiaires, lui permettre nous de pratiquer bien et selon théorie l'école était banon et lui permettre nous tout et gagner un plus bon esprit d'équipe, les travailler avec l'autre infirmière yo collaborer très bien ensemble avec nous.
Ça moi plus mais l'hôpital Saint-Boniface c'est prise en charge que on fait pour patients yo précisément monde sous chez eux côté que joindre un encadrement et grâce à l'hôpital là nous capables et on fait réhabilitation normale.
L'équipe là est tellement dynamique que nous jouons des pieds-et-ongles pour nous bailler patients aux soins avec le peu que nous gagnons. Donc ça a montré que il y a un dynamisme qui mettait en place pour l'hôpital à évoluer et l'hôpital a continué à évoluer et il y a un bagage que m'a souhaité tout c'est pour nous continuer à évoluer pour qu'il ça pour nous bailler un meilleur hôpital dans Caraïbes là tout.
Ça me plus maintenant l'hôpital Saint-Boniface. Nous sommes toujours prêts pour nous bailler patients aux soins et nous toujours jouer un bon soin en retour et toujours féliciter nous pour le travail que nous faisons.
Depuis 12 janvier, je suis sorti de Port-au-Prince. Je suis venu, c'est l'hôpital là, je suis malade. Bon, c'est ici, je refais, Ngaya. Je refais Ngaya, c'est l'hôpital là que je refais. Pour l'état, c'est l'hôpital là que je me campé sous des pieds moi-même.
Happy 40th anniversary, and we will continue to make it better. And we are looking forward to celebrating our 50th anniversary. God bless everyone who started Saint Boniface, everyone who are continuing to support us, and everyone who never gave up on us.
Thank you, everyone. Thank you. Before we break for dessert, I just want to say thank you to a few people tonight. One is Father John, Lisa Pickering, everybody here at St. Cecilia's. Thank you for being such generous hosts. Thank you. I'd also like to thank everybody on the dinner committee. If you could please raise your hands. Under the incredible leadership of Beth Floor, the incomparable leadership of Beth Floor, this night has been such a success. Thank you. Thank you, Beth. Thank you, everyone on the committee. And also want to thank everyone from our team here, everyone from the HI team. Some have flown up. We've got a bunch of people from our team here. If you could please raise your hands as well. Thank you. Thanks, everyone. Thank you all. Whether this is your first time here or you've been coming here for 40 years, thank you for being partners with us in this work. We really appreciate it, and we're really grateful for all that you do to make our work possible. Thanks, everybody. Have a good night. Thanks.